this is Dr. Rajitha Vanga and today's topic is on development of renal system. So the major part of the genitourinary system develops from intermediate mesoderm. Means the genital system and the urinary system, they are mainly from the intermediate mesoderm. So here is the cross section of the embryo and this is the lateral view of the embryo we can see, where we can understand on each side of the neural tube and notochord we can see the intraembryonic mesoderm. So intraembryonic mesoderm is further divided into three parts. The part which is near to the neural tube, these segments are the somites which are from the paraxial mesoderm, and lateral most is the lateral plate mesoderm, which is divided by a cavity inside it, which is called intraembryonic coelom. So what we are interested today is the intermediate mesoderm, which is in between. So the red colored structure what you are seeing in between the paraxial and lateral plate mesoderm is the intermediate mesoderm. So major part of our genital system and urinary system, they are all derived from the intermediate mesoderm. So intermediate mesoderm, it is like a longitudinal strip of intraembryonic mesoderm lying on the either side of the notochord between the paraxial and lateral plate mesoderm. So this red colored stretch what we are seeing next to the development of somites, these segments are the somites which are from paraxial. So next to the development of somites we can appreciate intermediate mesoderm. So after the folding of the embryo, the intermediate mesoderm forms like a longitudinal elevation of mesoderm along the dorsal body wall on each side of the dorsal aorta. So on each side of the dorsal aorta we see the intermediate mesoderm present like a longitudinal ridge. This longitudinal elevation is called as urogenital ridge. So it is called as urogenital ridge. So urogenital system is from urogenital ridge. So we can divide this is the so urogenital system, it is from the urogenital ridge of intermediate mesoderm. So intermediate mesoderm, urogenital ridge is again divided into genital ridge and a nephrogenic cord. So we can see urogenital system mainly from the intermediate and little bit is from the urogenital sinus, that is from the ventral part of cloaca, that is urogenital sinus, which is from a part of hindgut, endoderm. And most of the urogenital system is from intermediate mesoderm, which is in the form of a ridge called as urogenital ridge, which is further divided into nephrogenic cord and genital ridge, where the genital ridge develops to form gonads in male's testes and female's ovaries, and nephrogenic cords will form urinary system, that is the renal system, where it gives rise to pronephros, mesonephros, metanephros and so on. So endoderm of the hindgut contributes in the terminal portion of the urinary bladder, whereas the intermediate mesoderm forms the longitudinal elevation along the dorsal body wall called as urogenital ridge. So as a portion of urogenital ridge forms the nephrogenic cord, which gives rise to urinary system. The nephrogenic cord develops into three sets of nephric structures from cranial to caudal. So the cranial most will be the pronephros, which are temporary structures, then mesonephrons, and caudal most will be the called as metanephros. So genital ridge gives rise to gonads. Nephrogenic cords gives rise to kidney, mesonephric duct and paramesonephric ducts. Next about the pro, meso and metanephros. So pronephros, they are formed in the beginning of the fourth week, that is in the cervical region, in the neck region they are formed, and it is a non-functional and completely regresses. However, its ducts, that is pronephric ducts, which open into the cloaca and persist subsequently as annexed by the mesonephrons. So the caudal part, so you can see the cloaca. So this dotted things are the degenerated mesonephric duct. So the caudal part continues to form mesonephric duct. So that is about the pronephros. So the pronephros persists as a permanent kidney in lower animals like cyclostomes and some telos fishes. Next about the mesonephros. Mesonephros develops from a differentiated of mesoderm within the nephrogenic cord to form mesonephric tubules. We can see the mesonephric tubules and a duct called as mesonephric duct. This mesonephric duct is called as, otherwise called as Wolffian duct. It is called as Wolffian duct, and it is the middle nephric structure. It is neither proximal nor distal. It is in the middle and develops in the thoracic and lumbar region, and partially it is transitory structure. And most of the mesonephric tubules, these tubules, they will regress and disappear, but the mesonephric, that is the Wolffian duct, this is the duct, it persists and opens into the urogenital sinus. This is the developing cloaca, where it forms, the anterior part forms into urogenital sinus. So you can see the mesonephric ducts opens into the urogenital sinus, and the ducts and the tubules of the mesonephros forms the tube to convey the sperms from the testis to the urethra. So they forms the vas deferens. They forms the ductal system in men, whereas this mesonephric duct or the Wolffian duct in female, it is mostly vestigial, and part of the mesonephric duct gets absorbed into the urinary bladder, forming the internal trigone of urinary bladder, and forms also the proximal dorsal part of urethra. So that is about mesonephros. Next about the metanephros. Metanephros develops from the outgrowth of mesonephric duct. So you can see these yellow ones, what you are seeing like ureteric bud is written here, and we can see the metanephros here. So the metanephros will go and join with the mesonephric duct, and this metanephros develops as an outgrowth of the mesonephric duct, which is called as ureteric bud, and from the condensation of the mesoderm and the nephrogenic cords called as metanephric mesoderm. It is called as metanephric mesoderm, and it is the caudal most nephric structure, and it begins to form at the week of 5th week, that is the 5th week of gestation, and it is functional in the fetus by about 10th week. It starts filtering the blood by 10th week. So the fetal kidney is divided into lobes. We can see several lobes in the beginning, and in definitive adult kidney will be smooth in contour. So this metanephros will appear to be like lobes in the beginning, and later it forms a smoother texture kidney. So we can see the metanephros joins with the ureteric bud to form a complete kidney. So ureteric bud will form the collecting part of the kidney, and the excretory part is formed from the metanephros or metanephric blastema. So here is the sagittal view showing the degenerating pronephros. Now we know most of the mesonephros gets degenerated. Only the duct remains, which is called Wolffian duct. It forms the ductal system of male genital system, that is the vas deferens, and it also forms a part of that is internal trigone of urinary bladder, and it gives rise to ureteric bud as well. And ureteric bud joins with the metanephros. Metanephros is the actual kidney which it forms. It is initially lobulated, it becomes a smooth texture, and this metanephros, it starts functioning by 10th week. It becomes functional by 10th week. So it begins during 5th week of development and becomes functional by 10th week of development. So that is about pro, meso and metanephros. So next we shall understand the metanephros forms permanent kidney having two portions. One is the excretory portion, the other is the collecting system or collecting portion. The excretory, in some books it is given as secretory also. So the excretory system constituted by nephrons. It is nephrons. So this is the metanephrons, we can see. This is metanephric blastema, and this is the ureteric bud, we can see, and forms a renal vesicle, and it turns to form comma shaped, then S shaped, and we can see the nephrons starts developing from this renal vesicles, and we can see the blood vessels growing into the efferent and efferent arterioles, which grows into the Bowman's capsule, forming a tuft of blood vessels in the nephrons. And this is the collecting part, which is derived from the ureteric bud. So the collecting part joins with the nephrons to form a complete filtering structure, functional nephrons. So the inductive influence of collecting ducts causes the metanephric mesoderm to differentiate into metanephric vesicle, which later gives rise to a primitive S-shaped renal tubules that are critical to form nephron formation. These S-shaped tubules will turn to form nephrons in later. The renal tubules differentiates into collecting tubules and the distal convoluted tubule, which is called as loop of Henle, the proximal convoluted tubule, Bowman's capsule. So the tuft of capillaries uh, develop in the glomeruli and they protrude into the Bowman's capsule. So collecting system, that was about this excretory system. Collecting system originates from the ureteric bud, which I said earlier, and an outgrowth of the mesonephric duct initially penetrates the metanephric blastema, that is the metanephric mesoderm, and then undergoes repeated branching to form the terminal part of the ureter, renal pelvis. Then it forms the major calyces, minor calyces, and collecting ducts. So ureteric bud gives rise to the collecting system, that is a ureter, renal pelvis, major and minor calyces, and entire collecting system. So the collection between the collecting and the excretory tubule system is essential for normal development. The connection between this collecting and the excretory tubules, this communication is very important. So early division of the ureteric bud may lead to bifid or supernumerary kidney with ectopic ureters, and kidneys develop in the pelvic region and later ascend. Usually if you see the development of the kidney, it develops in the pelvic region and later they ascend into adult position, that is in the lumbar region. So abnormal ascent of the kidney may also result in some anomalies uh, called as horseshoe kidney, where the two lower poles of the kidney will fuse and all. So that is a basic idea. So we know metanephric blastema, which is from metanephros, forms the excretory portion, forms the Bowman's capsule, proximal convoluted tubule, loop of Henle and distal convoluted tubule. Ureteric bud forms the collecting portion. It forms collecting tubules, renal calyces, that is minor, major, and then forms the renal pelvis, ureter, and also it gets absorbed into the urinary bladder, forming a trigone of urinary bladder. So this is a basic concept of development of kidneys and collecting portions of it. One thing to be noted, the epithelium of the ureter is derived from the metanephros, the epithelium. So though the epithelium we are telling from the ureteric bud we know it is from mesonephros, but the epithelium of the ureter is derived from the metanephros. This point to be noted. Next, about the ascent of the kidney, how the kidneys ascend up from the pelvic region to the lumbar region. So the fetal metanephros is located at the vertebral level, that is in the pelvic region, S1 to S2, vertebral level S1 to S2, whereas the definitive adult kidney, it is located in the vertebral level, that is T12 to L3. So S1 to S2, T12 to L3 is the adult position. So the change in the location results from the disproportionate like growth of the embryo caudal to the metanephros. So during the relative ascent, the kidneys that is rotate 90 degrees. So along with the rotation, if you see here, the ureter is anterior, it is on the ventral side, and in you see adult, it is on the medial side. So there is a rotation of the kidneys along with the ascent. So the kidneys rotate how many degrees? 90 degrees. You can see here, this is anterior. When it rotates, it becomes medially. So 90 degrees, causing the hilum, which was initially facing ventrally, to finally face medially. And vascular buds from the kidneys grow towards the invade the common iliac arteries while in the pelvis. So in the pelvis they invade the common iliac arteries. As they ascend up, okay, so the growth of the embryo in the length causes the kidney to ascend to their final position in the lumbar region. So rather than drag their blood supply from the ascent, the kidneys ascend without a new and slightly more caudal cranial branches, which induce the regression of the caudal branch. So when they are ascending, the caudal branches will regress and a new branch will appear. Again, when they ascend, the caudal branches, you can see the dotted lines, they regress and the new renal arteries will appear. So finally they will get the renal arteries from the abdominal aorta directly, right and left renal arteries. So till they reach the suprarenal gland here. Suprarenal gland is actually located in the lumbar, thoracic lumbar region. So supernumerary arteries sometimes, what happens, these arteries instead of regressing completely, if it persists, it results in supernumerary arteries, which are the end arteries. Therefore, damage of any of them will result in the necrosis of kidney parenchyma. So that is about the ascent of kidneys. Next, about the formation of urinary bladder. Urinary bladder, if you might have seen the development of hindgut also, the anterior portion of the cloaca, which forms the urogenital sinus, and that forms the major part of urinary bladder. And the only the internal trigone of the urinary bladder is derived from this, that is mesonephric ducts, that is from the ureteric bud. So urinary bladder develops from the cloaca, which is a common collecting region of primitive kidneys and gut system. So the urorectal septum in the cloaca, cloacal region subdivides it into that is the anterior urogenital sinus and the posterior rectum. So we can see here, this is the developing urinary bladder, which is a urogenital sinus. So we can see the mesonephric duct and ureteric bud starts developing here. Slowly we can see the mesonephric duct starts getting absorbed into the posterior wall of the urinary bladder, and apex of the urinary bladder continues to form allantois in the developing life, and this allantois, it gets obliterated and forms a fibrous band which forms urachus and median umbilical ligament, and the distal part of the allantois is patent to form the apex of the urinary bladder. So urinary bladder is formed from the upper portion of the urogenital sinus, which is continuous with the allantois. The allantois becomes fibrous cord called as urachus or median umbilical ligament in the adults. So the lower end of the mesonephric duct becomes incorporated in the posterior wall of the bladder, forming the internal trigone. You can see this part, forms the internal trigone of the urinary bladder, which is the incorporated portion of mesonephric duct. So ureteric bud opens. So initially there is a common duct, common mesonephric duct, and once the ureteric duct and the mesonephric duct, they starts getting separated. So mesonephric duct opens caudally, where it forms this tube. This is the vas deferens in males, and this trigone, this absorbed part, forms the internal trigone of urinary bladder. So that is about the development, and we know the urachus, that is allantois, attaches to the umbilicus, forming a median umbilical ligament. So that is about the urinary bladder. So internal lining of the urinary bladder, the urogenital sinus, whichever develops except internal trigone, it is lined by the endoderm of the cloaca, whereas the internal trigone is from the absorbed part of mesoderm. The musculature of the urinary bladder and connective tissue of the urinary bladder is from the surrounding mesenchyme. So this is a summary of urinary bladder development. So cranial dilated part, which is called as vesicourethral canal, develops from endodermal epithelial lining. It forms in adults as endodermal. So this is an embryonic structure, adult derivatives, endodermal epithelial lining of whole urinary bladder except in the region of trigone. Absorption part of mesonephric ducts into the dorsal or the posterior wall of vesicourethral forms the mesodermal epithelial lining in the region of trigone of the urinary bladder, and splanchnic intraembryonic mesoderm surrounding vesicourethral canal forms the muscle and serous coats of urinary bladder, and allantois forms the urachus, which is the median umbilical ligament, and distal part of it forms the apex of the urinary bladder. So that was about the development of urinary bladder. Next we shall understand the development of urethra, male and female urethra. So we can see the absorbed part of the mesonephric ducts forms a part of the urethra as well, and also the caudal part of urogenital sinus also gives rise to a part of urethra. In females, only the urethra is formed from the mesonephric ducts and absorbed part of the urogenital sinus. In males, we can divide it to prostatic part, membranous, penile and terminal part of male urethra. So we can see each part what it forms here. So embryonic structures, female urethra, caudal part of vesicourethral canal or urogenital sinus, and pelvic definitive part of urogenital sinus forms the female urethra. Male urethra, caudal part of vesicourethral canal forms the prostatic part above the openings of ejaculatory ducts. Below the openings of ejaculatory ducts is formed from the pelvic part of definitive urogenital sinus. And membranous part is from again pelvic part of definitive urogenital sinus. Penile part is from the phallic part of definitive urogenital sinus, and terminal part is from the surface ectoderm, which occupies the that is glans penis below that. Let's see some congenital anomalies. Horseshoe kidney means the lower poles of the kidneys are fused. It develops as a result of fusion of lower poles of the two kidneys. So the ureters pass anterior to the isthmus. You can see the connection between the two lower poles is called as isthmus, and we can see the ureters run anterior to the isthmus and may get obstructed due to the impingement. And we can see the inferior mesenteric artery. This is the inferior mesenteric artery. So here is the inferior mesenteric artery, which is the ventral branch, and we can see this right and left renal arteries arising from the abdominal aorta, and this is inferior vena cava. So inferior mesenteric artery also passes anterior to the isthmus. So when it runs down, it comes anterior to the isthmus. Inferior mesenteric artery runs anterior to the isthmus, and the horseshoe kidney would be trapped, hindering its ascent of the kidney. So it gets trapped inferior to the inferior mesenteric artery as it attempts to ascend towards the normal adult location, and causing the obstruction or narrowing of inferior mesenteric artery. So this is about the horseshoe kidney. So the next anomaly is polycystic kidney. Here we can see the normal kidney, and this is the polycystic kidney, and we can see a lot of cyst within the kidney. It is because of failure of communication between the nephric part, that is excretory part, and the collecting system. So the nephrons fails to establish a communication with the collecting ducts or collecting tubules. So as a result, what happens, the nephrons will be functioning by excreting the urine, but the excreted part, because there is no outlet there, they will start accumulating, forming this cyst, so which is called as congenital polycystic kidney. So the glomeruli continue to excrete urine, which accumulates in the tubules due to the lack of outlet. So as a result, the tubules undergo cystic enlargements. So these cystic enlargements are also called as retention cyst. They are called as retention cyst. So that is about the polycystic kidney. And some more anomalies, like because of failure of ascent, the kidney may be inside the pelvis itself, called as pelvic kidney, or sometimes ectopic kidney, which occurs when the kidney fails to ascend and thus remains in the pelvis. And two pelvic kidney may fuse, usually to form a single lobed organ, which is called as a cake kidney or rosette kidney. It is called as cake or rosette kidney. The next condition is the bladder extrophy. Extrophy is because of it is ectopic bladder, where the ectopic bladder is due to the failure of formation of ventral body wall. So the lower part of the anterior abdominal wall defect. It is caused due to the lack of the two lateral foldings of the embryo. They have to fuse in the midline, right, in the pelvic region. So because if there is a closure of the lateral pelvic wall folds, resulting a protrusion of the urinary bladder through the defect, which is called as bladder extrophy. Next is the urachal fistula or the urachal cyst. We are going to see this fistula, where it is a complete allantoic diverticulum. It is patent. We can see it is patent, resulting a patent urachus or urachal fistula. And in second condition, we can see the polyp, where the distal part of the allantois is patent, and proximal it is obliterated, forming a fibrous median umbilical ligament. So this is called umbilical polyp. And here you can see the bladder diverticulum, where the proximal part is open and the distal part will form a fibrous diverticulum. And we can see urachal cyst, where fluid filled cyst is formed between where the proximal and distal parts are obliterated, and the allantoid diverticulum is persistent in somewhere in between, which is called as urachal cyst. So these are the congenital anomalies of renal system. And one high yielding point to be remembered, that is urinary bladder, liver, pancreas are endodermal derivatives, but kidney is mesodermal in derivative. So this thing should be noted. It is from metanephrons from intermediate mesoderm, so it is mesoderm in derivative. Urinary bladder, not complete urinary bladder is endoderm, that is only the internal trigone is from the absorbed part of mesonephric ducts. So this completes the development of renal system and some congenital anomalies associated with it. Thank you.